Hi, so in my last 24-hour duty day, obviously in the starting morning 8 to 4 o'clock vacuum, we'll have this thing called as an OP day. So a patient came from the ortho ward. He actually went to the ortho ward with complaints of left shoulder pain. But what happened was it started to become severe for the past 2 days. And the sir was like, go and have an opinion from the general medicine ward. So he came in the entrance itself. I was there, and then he was wearing a lungi. He was wearing a shirt, and it was completely drenched. And he was saying, "I'm having left shoulder pain and a little bit of chest pain." And immediately, without even I didn't take a proper history. I asked him whether he smokes or whether he drinks, and how his chest pain is. And he was telling that it's pressing him, or he's been sweating a lot now. He's feeling anxious, and he's a known alcoholic. So I was like, the problem was I didn't even write the case sheet. I was like, wrote an investigation. I had these forms in my pocket where I'll like have these what do you say? These requisition forms we say to write investigations. So I immediately wrote an ECG and wrote his details and signed it, and asked him to immediately get an ECG. And I was waiting in the ECG, and I saw the ECG chart, and then I saw an ST elevation. That is basically a myocardial infarction. That is in layman's term, it's known as a heart attack. So this person is actually having an heart attack, an evolving heart attack, right in front of me. And I was like, I rushed to my PG ma'am. I told her that, ma'am, there's a myocardial infarction case. And she asked where, and I said it's there. And I was like writing the loading dose. It's yeah, and especially if you have old people in your house, you should have this loading dose for myocardial infarction at your home itself. It's aspirin 300 mg, clopidogrel 300 mg, and atorvastatin 80 mg. So have these drugs. And then I wrote it and immediately rushed him to the ICU, and we admitted him. We gave him the loading dose. We asked him to call his family members. They came, and then we told them that it's evolving, so we can actually fibrinolyze it. And after that, like, I asked him proper histories and did a little examination, and so he was a known hypertensive, known diabetic on default. That is, he's not taking proper medications. So it's important, actually. It's important to take your medications. It's important to not stop your medications just because you became normal or there's no signs or symptoms. Always consult a doctor and stop your medications. That I would say. And then he came to the we admitted him to the ICU. We explained them that we can actually fibrinolyze him. That is, the clot which is blocking his blood vessels of the heart. We can actually put an injection and basically melt it, those clots. So they were like, okay, let's do it. And we explained that it's actually an expensive drug. It costs about 20 to 25,000 rupees. So, and they were fine. They were okay with it because this is actually a life-threatening condition. If not identified properly or identified quickly, the patient would have passed away. So identifying it immediately without making him delay, that was a good call. And I rushed to the pharmacy. We got the drugs, and obviously the postgraduate PG ma'ams, they loaded the drugs. We did a repeat ECG after 90 minutes, and I saw signs of perfusion. That is, the miracle about it is the real. I was treating the patient. Obviously, the patient was in a lot of pain, but after the loading dose, after the treatment and all, he felt the pain go away. That was a really happy feeling. That he was anxious, and now I was a part of treating him. And that was there. And then what happened was, I could see the signs. I could see the textbook words coming in life. You know, you read about something. Maybe you do a max problem, or you do something like an accounts problem in your college, in your school days, and then the exam comes, or some sort of a real life situation comes. For example, you're reading about compound interest, and then boom, you're investing, and you see these compounding effects and all that. So it's like a real life practical example of reading about myocardial infarction in the books, and then it just comes alive. And so I felt happy that I was able to make a set of good calls. Maybe a few seniors might say, no, you're supposed to document it and all that. But at the end of the day, the patient is the center of everything. So that was something, it felt really satisfying, even though my internship stipend isn't satisfying. but but the treating part is really, really a very satisfying thing. I don't know how to put it in words. So yeah. After, first he initially came, the ECG findings were, I could immediately spot it. It's a atroseptal myocardial infarction. Sorry, what's that called? It's called as anteroseptal or septo-anterior myocardial infarction. And then after 90 minutes of the fibrinolysis, we put two doses. So after that we take a repeat ECG at 90 minutes, and I could see the signs of reperfusion in the ECG. And then, so obviously we had to refer them to a PCI center, where they'll do an angiogram, and if stenting is needed, put a stent or do ballooning and treat him further. But yeah, making a series of good calls. And actually the patient came in at around, I think, 10:45 a.m. All this treatment got over, and he was referred at around 12:30 itself. So within 3 hours, a life-threatening condition, from door to the exit, it took 3 hours. That's I feel maybe here and there we could have fastened it up a little more. But yeah, I feel way satisfying.